Welcome to another Sono of the Week, where I find an amazing clip that I just feel obligated to share with you. This is dedicated to our chief residents of emergency medicine, where they learned about this very thing and were so excited they had to talk to me about it when they arrived back from the Essentials of Emergency Medicine conference. And in this first clip, we have a huge dilated stomach that is just full of fluid with some air bubbles. And you can see air line on the anterior surface of the stomach. It's closest to the probe. Remember, air will layer on the top, whereas fluid will layer on the bottom. It's creating a nice dirty shadow, which also indicates air. And what I find super cool about this clip, especially the next one here, is that you can actually see the pulsations from the heart shaking the contents of this dilated fluid-filled stomach. So why did this patient have a giant fluid-filled stomach? There can be many reasons, such as gastroparesis, but in this case, the patient had a small bowel obstruction. And if we look at the small bowel, it is dilated, packed full of fluid. You can see a thickened wall and very nice delineated plicae circularis throughout. Recall that the big things we look for with ultrasound and small bowel obstruction is a dilated small bowel, which is more than 2.5 centimeters in diameter, a thickened wall greater than 3 millimeters, and this anterograde retrograde peristalsis. If you evaluate all four quadrants, you often can find the transition point. You'll see abnormal bowel above it and normal peristalsine bowel that's not dilated below it. This point-of-care test can be useful in the right clinical setting. It can give you an answer right away, but remember, it's not the most sensitive test, so you can't rely on it 100%. The patient's clinical presentation in your exam is critical, and use the other tests at your disposal. X-ray is not the greatest either, and so you may have to go to CT with IV and/or oral contrast. But if you're concerned about a surgical emergency, get your surgeon down to evaluate the patient early, do frequent exams, and use point-of-care ultrasound to help guide your management in the right direction.